So the basics you know, and try to recapitulate and study among your friends, and whenever you get a chance in the dissection hall, please see the pictures, see the walls. You have nothing to know, you have not bought a book. You see the walls every wall is covered with illustrations. Even, see, you are in the examination hall. We are not taking you into a room and then one by one we are bringing. So instead of focusing on what the examiner is asking, you try to see if you are forgetting any, the basic things will be asked to you. Basic things, basic structures, basic, what are the valves of the heart? Now, how the papillary muscles of the heart, the chorditendinae, or what are the features of the muscles? So, please, I'm telling you, concentrate on basic fundamental, because your syllabus is very much have become, at least you have to utter a word. Okay, now this is the left atrium, right atrium, left ventricle and right ventricle. See the chambers of the heart, and you can see the seminal valve open, the right atrium, atrioventricular valves here. Now, this is a fundamental slide showing the heart, the right atrium, right atrioventricular valve, right ventricles, pulmonary and pulmonary artery, the lungs, it goes into the lungs, arteries, arterioles, capillaries, venules, veins. Now from there it goes to the pulmonary vein and to the left atrium, left atrioventricular valve, left atrial, left ventricle, and the aortic node and aorta, arteries, each organ and arterioles of each organ, capillaries of each organ, and venules, veins of each organ, vena cava. This is the cycle, and every organ is to be supplied by a artery and drained by the vein. And this is the basic concept. If you have this in your mind, then when you go to the thoracic cavity, then the lung and the heart will be taught to you. And again you go, a diaphragm separates the thoracic cavity from the abdominal cavity, and the abdominal aorta proceeds and it branches to the organs in the abdominal cavity. Now, classification of blood vessels. The classification: arteries, arterioles, capillaries, sinusoids, cavernous tissue, venules and veins. This is the basic design of the classification of blood vessel. Now, you see the arteries, I am repeating, arterioles, capillaries, sinusoids and cavernous tissue, venules and veins. Now, you see, this is the heart. Now, this is a large vein, the Tunica Intima, Endothelium, basement membrane, and Tunica Media, externa. Now, you see the medium-sized vein is a valve here, Tunica Intima, Endothelium, basement membrane, Tunica Media, Tunica externa. It's a tube. Naturally, from external to internal you go. Now, it has muscles also. The histology, if you see, you will be seeing the same thing. When you in the dissection hall, whatever you see, the veins and arteries, you can feel it. You will feel, you tie a tourniquet here to take blood. Then what happens? You just ask the patient to do like this. Okay, then you will see the brachiocephalic vein. Over here, these are the veins where you can take the blood. Even a patient comes in shock, like you are getting the pulse all through pulse. Then what you do, you cannot, like in a hurry, you have to put transfuse or infuse blood or infuse intravenous fluids. Then what you do is that you have to know the group of the patient, blood group. You have to send it to the lab. You do a femoral tap. You see over here the femoral vein is there. Femoral artery pulsation you will get, and this medial lateral to it you get the femoral vein. Now the vein you puncture and get the blood at least 1 ml. Okay. Now I'm just telling you that see the capillaries, these are major vessels, and this is histology, vein, artery, comparative. This is the comparative thing, you see. Now arteries, the arteries are thick walled tubes which convey the blood from the heart to the capillaries. Structure of the artery, from within outwards, the artery presents 3 coats: Tunica Intima, Tunica Media and Tunica Adventitia. Now see the artery, this is the lumen, the Tunica Interna, Tunica Media, Tunica Externa. Now see this is this Tunica Intima showing flattened endothelial cells, subendothelial areolar tissue. This is endothelial subareolar tissue. Internal elastic lamina, Tunica Media with concentric and alternate layers of smooth muscles and classic elastic tissue. Thickest layer is here. Now Tunica Adventitia, strongest layer, external elastic lamina. Types of arteries. The arteries are of 2 types, elastic and muscular. The predominance of elastic tissue and is known as elastic, and muscular, predominance of muscular tissue. Now elastic arteries, conducting vessels. Conducting vessels means most of the large arteries are elastic, where the Tunica Media consists predominantly of elastic tissue and less of muscle fibers. Examples are aorta, pulmonary trunk, brachiocephalic trunk. It can be a short note of 4 marks or 2 marks, or what is the difference between, now the types of arteries. The arteries are of 2 types, elastic and muscular. Elastic arteries, conducting vessels. Most of the large arteries are elastic, where the Tunica Media consists predominantly of elastic tissue and less of muscle fibers. Examples are aorta, pulmonary trunk, brachiocephalic trunk. Now this is the histological picture. This is the endothelial layer, this is the elastic fibers, and this is the muscle. Most of the distributing arteries are muscular, where Tunica Media consists of more muscles and less elastic tissue. The muscles are mainly composed of circularly arranged smooth muscles. Circularly arranged smooth muscles. This is the endothelium. These are small blood vessels, the Tunica Adventitia, Tunica Media. Transverse section of the, you can, when you go do histology, will show you the artery section, then you will see similar picture you will have. Okay. Capillaries. Capillaries form a network of blood vessels where the arterioles empty. Arterioles arterioles, resistant vessels. These are the smallest divisions of the muscular arteries possessing three coats. As the arterioles progressively divide into smaller branches, their coats become thinner and form successively terminal arterioles and metaarterioles. The terminal arterioles are devoid of internal elastic lamina and are covered by continuous coat of smooth muscle. Now see, from the heart, this is the arteriole, this is the metaarteriole, along the smooth muscle fibers and endothelium. Now you can see the capillary network, precapillary sphincters are here and the capillary bed. True capillary is here and thoroughfare channels, these are the, it's like this, it's like a mesh. Like in some areas of the body, you might be encountering bleeding when you cannot catch it. You don't panic, you just hold it with one hand and swab. And then if it is a minor, you don't take this big hemostatic forceps. You take, there are the small, to catch these minor vessels. Okay, hemostatic forceps. Now here to the heart it goes, again to the heart is from the heart, arterioles, metaarterioles, this is the picture. The precapillary sphincters are here, muscle fibers and thoroughfare channels. Structure of capillaries. Each capillary is lined by a single layer of flattened endothelium resting on a basal lamina, which is composed of glycoprotein. The capillary endothelium may be continuous with fenestrated. Continuous capillaries are present in most parts of the body, particularly in the lungs and brain. Fenestrated capillaries are found in the renal corpuscles and endocrine glands. Now, this can be a short note or it can come as an MCQ. Now, the continuous capillaries are present in most parts of the body, particularly in lungs and brain. Now, where structure of each capillary is lined by a single, which is composed of glycoprotein. The capillary endothelium may be continuous or fenestrated. Continuous capillaries are present in most parts of the body. Now, capillaries are found in the renal corpuscles and endocrine glands. Fenestrated. Veins of the body. See, vein, this is the artery, it's in circle. Now, capillary anastomosis. See, this is the arteriovenous anastomosis. This is the vein, this is the artery. There are some malformations from congenital this thing that can be a hemangioma. And see, it represents as a small tumor. So don't you palpate and see if it is a hemangioma or cyst or a fibroma or a lipoma. Because once you press like this, it flattens. Slowly you will release one side, slowly it will be filled. It will be filled on the other side. You leave it, it will come again like this. But if it is a fibroma, if you press, it is hard. Hard means as compared to the hemangioma. Or arteriovenous malformations. Now, if it is a lipoma, it will be soft. Soft, it is movable. If it is a fibroma, a neurofibroma, you can have a small neurofibroma. Then you see how it is nodular and also you can palpate and differentiate. Now, see what happens actually. You uh, diagnose as this thing, but hemangiomas or this thing, people will come, ডাক্তার বাবু আমার এখানে একটা হচ্ছে, এখানে একটা টিউমার হয়েছে, হ্যাঁ, then you see the vessels in these areas, the forehead. So there are some injections you give for hemangiomatous growth, small growth you can inject. Now that you can do, but don't make an incision without examining it properly. At the most, what is that? You are having a very good, one of the best imaging tools is ultrasonography. It is one of the best, even after a CT scan, even in the abdomen, the radiologist suggests that do an USG for further confirmation. So you have a USG, you can, very good centers have minor probes, small probes, they can do. Because see, if you have to go for this thing, I am a general surgeon, you can, this thing, you have to refer to a plastic surgery department. Okay, how they will handle. But most of these vascular malformations, if it is big, it is actually, they don't go for a direct operation first. Okay, now the capillary anastomosis. The capillaries, number of pre-capillary anastomosis here. Pre-capillary anastomosis here. Now, endothelium vessels and atherosclerotic plaque. See, due to hyperlipidemia, you get the plaques are there. So there can be a foot, probably this is diabetic foot, you can see. Last week, a patient from Kolkata came to me. His hands, he was having these, the color Doppler study, and he had this middle finger was gangrenous change. It turned black. Also, the palm of the hand and the middle finger was swollen, and there was fluid. The echogenic material was there, pus collection was there. And what I did is that I dressed with honey for 5 days. Then the gangrenous part, these are the phalanges, fingers. Okay. Now, this portion, this part of the bone, simple radiological. Radiological picture give necrosis and this thing. But first day, if I say, no, it will hang cord, this is very, it will spread and all this big talk for a big show. So 2 days I just dressed and I counsel the patient. Now let's see how I can manage. Let's see. I try to, but it's turned black naturally. You have to ultimately cut it. But let's see how much progress is there. Now there was swollen, this thing, index finger, middle finger. Now ultimately, got the confidence that something is being done. In Kolkata, some surgeon said you have to cut the whole your middle finger. Now that's is a diabetic. He is having this atherosclerotic plaque. Naturally, I just persuaded, no, you don't have to cut. Let's see. So after all, then I just removed the terminal. This I removed. If I stayed I used honey for more period for 10 or 15 days, there are some your enzymes, catalytic enzymes and different enzymes, it makes the tissue soft. It makes the tissue soft, and then you can just strip off with the thing. Anyway, they came for a short period. I didn't kill time. I slowly persuaded him. And the thing is that his eyesight is not very good. He cannot visualize much. His vision is lost to some extent. Now, I'm speaking on the psychological part of it. Okay. Now, you see, these conditions arise. It might be a small finger, this little finger. Try to preserve and try to understand the anatomy and the pathology, and then you intervene. You have beautiful tools, beautiful diagnostic methods that you can go through. Of course, even in these conditions, first day I don't give the verdict that you have to amputate. Ultimately, if this is this portion. Why you are in a hurry? It's already dead. If it is a dead tree or branch of a tree, then the water from the ground going through the tree, will it go into the branch? Will it go? So then how will this infection and all this will be transported into the main trunk? So you need not, but you have to do it. You don't be in a hurry. You are here for 6 years. I think I can have an opportunity. I'll show you that you did not amputate within the first day or within 5 days. You make a verdict. इसको काट देना है, इधर से काटना है, इधर से काटना है. No. Okay. You have to understand the correlation with the anatomy and the pathology, and then you take action. Now, azygous vein, the superficial set lie in superficial fascia, great and small saphenous vein. The great saphenous vein and this small saphenous vein. This, when you study the lower limb, you will be seeing different, these veins are there in the dissection hall, you will be seeing. Greatest saphenous vein. Great saphenous vein is the longest vein of the body. Valves of the great saphenous vein, about 20 valves out of these saphenofemoral valve has functional importance. Incompetency of valves in superficial and perforating vein causes varicosity. This is the varicose veins. Varicose veins is very common in, बोलिए, very common in, बोलो. Okay, now policeman or persons who are standing long hours 12-hour duty, 6-hour duty, 8-hour duty on standing, then this valve becomes incompetent. And even women during pregnancy, they have some engorged veins. And that's a trend now to do some operations and all. But if it goes into extensive problem, then you think of an operation. Now, principal cause of varicosity, thrombosis of deep veins, persistent elevation of intra-abdominal pressure due to abdominal tumors or multiple pregnancies. Actually, a patient is operated. Last week I operated on a huge filarial scrotum and penis. I do operations, but what you try to learn is that when you go on your rounds, in the ward, your house staff or an SR, then please, or in a cardiothoracic department or anything, you ask the patient, after he recovers from the anesthesia, please fold your legs. And the attendant, it can be a professional, nurse or Aya, or in my hospital, not hospital I would say, a small nursing home, I routinely tell the patient party to give massage. In that, some people say, edu narkol tel dite parbo to? I'm going to narkol sorsher tel ja parbi dao. Because you have to just, and if you're sitting like this on the bed, lying for 12 hours, 12 hours or 16 hours, then what happens? I tell them to massage like this. These are the small things you have to cultivate and acquire in your clinics. Because of your anatomical knowledge, it goes into your these problems, the thrombosis of deep veins. Now, if there is thrombosis, there's the early movement, because and you have to say around 20 patients, but 20 patients is not undergone, only 5 patients is gone or 6 patients is undergone surgery in a week. So you focus on those 6 patients and try to make him ambulatory as fast as she can move or he can move. Go to the toilet. Now, see, I told you large tumors in the abdomen and this thing, pregnancy also I told you that you get thrombosis. But now these early stages, if you see when you are discharging, being a gynecologist or obstetrician, then advice for varicose stockings. There are some stockings from here to this much. Okay, these are the small things you have to learn. Now you can see